From the campus of the University of Nebraska at Omaha. Consider This, a program of issues and information behind today's news.
It was really my son's decision to be vaccinated, but my husband and I fully supported it because we wanted him to resume having a normal childhood and having some opportunities that he'd missed out on during the pandemic.
Well, I decided to get vaccinated so I could safely see my friends in person, but also to help protect myself, my family, and my community.
Hi everyone, I'm Kathy Wyatt. Welcome to the 25th season and this week's edition of Consider This. Our topic, a COVID-19 safety checklist. Joining us to talk more about it is Sarah Hurtado Bears. Dr. Bears is an associate professor in the Division of Infectious Diseases at UNMC. Thank you so much for being here and welcome.
Yeah, thanks so much for having me.
I just want to start big picture. Talk to us about the number of COVID cases to date that have been reported nationwide, and then we'll go into the deaths.
Sure. I mean, the numbers are quite staggering. So in this country alone, we've had over 90 million cases of COVID-19 infection that are documented. Now, the actual number is probably significantly greater, but there have also been over 1 million deaths due to COVID-19 in this country alone. Dr.
Bears, let's kind of drill down a little bit into Nebraska. What are we looking like today?
Yeah, so even here in Nebraska where we've been, had periods where we had more infections and fewer infections, we've had thousands of infections and over 500 deaths in our state alone.
There's a BA.5 variant, subvariant, right? Mm-hmm. And it is driving numbers again, right? It's driving the number of cases, the number of hospitalizations. It's kind of the here we go again, on top of these numbers that you've been talking about. How seriously should we take this? I mean, talk to us about that. When we hear about rise now, where should our heads go here?
Yeah, I think it's hard because everyone's kind of become numb to the numbers. We don't even want to pay attention to them anymore because it just feels constant and we're not getting a break. But I think it is important to be paying attention to these numbers in particular. This variant is much more contagious than prior variants, whereas the original variant had an RO, or an average number of people who were infected of 3. This one is infecting about 18 people on average. So one person will infect about 18 people. And that's significant. I think that's in part because the virus has learned to evade both vaccine-induced immunity and natural immunity. So people who've been vaccinated, people who have had COVID before are all susceptible to this new variant. Okay. As a result, we are seeing more hospitalizations as well. Fortunately, the tools that we have to prevent severe disease are still working. So our vaccines are still working to prevent severe disease. And we have antivirals now that we didn't have at the beginning that can prevent the progression to severe disease and hospitalization.
One of the things that we are hearing is, well, it's just not as bad anymore, right? So if I get it, or there have even been people who've said, well, we're probably all going to get it, right? Mm-hmm. How do you respond to folks? Maybe it's just reminding them everybody responds differently, right? What would you say?
I would say that if you have maximized your your own immunity and been fully vaccinated, that it's going to affect you differently than it's going to affect those who are not yet vaccinated. Also important to remember that some people are much more susceptible to severe disease even if they're fully vaccinated. So the elderly, those with compromised immune systems, and those make up a really large number of the members of our community who we want to be looking out for.
Okay, talk to us a little bit about the evolution of these subvariants.
Sure. Yeah, so this virus is much like many other respiratory viruses. It changes over time, and over time those changes in very small portions of the virus allow it to become both more infectious and to evade immunity. And that's going to continue to happen so long as the virus is present in our community. And it's more likely to happen when it lingers longer, when it causes longer infections. And so that's the case in people who are not vaccinated, and in the people who have compromised immune systems who are not able to clear the virus as quickly. So things that we can do to prevent that evolution of the virus are to become vaccinated, and those who are eligible can also receive antiviral medication to shorten the duration of the illness.
Okay, and I think I've said this a number of times over the past few years, we don't have a crystal ball.
Yeah.
But given what has transpired, what are you anticipating, you and your colleagues, happening next?
It's hard to say. You know, I'm optimistic that we will have a more Omicron-specific booster in the fall that may provide more protection against these subvariants. But I don't know for certain that that will happen. I anticipate that as we head indoors this fall and winter, that we will see more infections, especially given that there are large numbers of our community who remain partially and incompletely vaccinated.
Okay, and I need to ask because it depends on the article you're reading.
Yeah.
Is COVID still considered to be a pandemic, and why?
Yeah. It's still a pandemic because it's still causing large numbers of infection worldwide. I think we've reached a new phase of the pandemic where it's not universally deadly and feared. You know, a lot of things have changed. We have new tools, we have vaccines, we have antivirals, and although hospitalizations are on the rise right now with the Omicron subvariant, we have seen ICU admissions plateau. I think it's a pandemic, but it's at least in a new phase.
Okay, and it might not be a bad time to remind our viewers of signs and symptoms, especially
Sure.
as we head into the fall.
Yeah.
A new set of allergies are going to be coming up and things like that, and we don't want to confuse this with that.
Yeah.
So talk about the signs and symptoms.
The hard thing is that it can actually be nearly impossible to differentiate between COVID-19 and allergies, and so I think having a high suspicion for COVID is always useful, even if you think it may be allergies, thinking that there is a lot of COVID spreading in the community and this could be COVID. So the common symptoms that we're seeing, especially with this new variant, are just like any upper respiratory symptoms. So sore throat, congestion, cough. We are seeing systemic symptoms like fever, headache, chills, fatigue. In children, it can often present with gastrointestinal symptoms, so nausea, vomiting, diarrhea, fatigue. My children had COVID, unfortunately, this summer. We traveled and very few people were wearing masks on the plane, and my children both got sick, and my older son, the only symptom he had was fatigue. The reason we suspected it was because my other son was sneezing and coughing. But really important to just, know that they can be mild and they can look just like allergies or any other cold.
Okay, talk to us a little bit, doctor, about the testing. So we feel like maybe we're exhibiting some signs and symptoms, but we want to be sure. So where do we go nowadays to be tested?
Yeah, so we're fortunate in that home tests are widely available. They're available through the government, through insurance will pay for home tests that you can pick up at the pharmacy or drugstore. They're a really good tool to use, but these tests are antigen-based tests and they're not perfect. So they can often, especially with these Omicron subvariants, be negative in the first couple days of symptoms. So what I've told my patients and what I tell my friends and family members is that, if you have symptoms that could be due to COVID and you have a negative antigen test, sit tight, isolate, and repeat that test a day later, or go in for a PCR test. Go to the doctor's office and get a PCR test. If it's positive and you have symptoms, you can trust the test. It's likely a true positive.
Okay, and there have been questions. Again, we've been doing this for a long time. People catch wind that somebody has COVID.
Yeah.
If we're testing positive, what are we supposed to be doing? Maybe we remind people of that.
Yeah, so isolation is important. We want to remember that number. On average, Omicron is affecting 18 people. And we want to minimize that risk, especially to those who in our community who are more susceptible to severe disease. And so isolation is still really important. It's especially in that first week of illness that we're most contagious. And so that's key. Don't get on that plane. Don't travel. Even if you're sick and want to be home, stay put and isolate is important. The other really important message that I want to be sure that my patients and others are aware of is that we have antiviral medication that's available, but it's most effective in the first 5 days of illness. So if you're sick, absolutely get tested. You want to get that diagnosis soon so that you can then reach out to see if you're a candidate for the antiviral medication, because those 5 days can pass pretty quickly from when you first develop that scratch or tickle in the back of your throat that you're not sure is really significant to by the time you test positive and get in touch with the doctor's office.
Okay, and what about the whole communication piece? So isolate is one thing. Again, back in the day, people were picking up the phone and calling people and saying, hey, I just wanted to let you know, we hung out the other day and I have COVID. Is there anything required of folks, or is it just really expected as a courtesy? How would you advise people to approach that?
Yeah, because there are so many cases at the beginning, county health officials would reach out and help with contact tracing and help you determine who you've been in contact with in the 48 hours before your symptoms started when you might have been contagious. There just aren't the resources to do that anymore. And so I think it's on us to let those who we've been in touch with, especially those who we've been in close contact with, know that you have symptoms, you've tested positive, and if they're vaccinated, they don't need to isolate, but they can at least test and be on the lookout for symptoms should they develop, so that then they can isolate if they do end up testing positive.
Okay, and I do want to talk about vaccines today, but before we do that, what are you seeing? Because we talked about, kind of current status, but let's talk a little bit about the challenges before we get into more of the solution. What are you seeing in your office or in the community to being some of the biggest challenges with COVID-19 as we're sitting here today?
Sure. I think the biggest challenges right now are still the fear of the vaccine. For many reasons, people are still scared that the vaccine may cause more undue side effects. They know a lot of people who have had COVID without the vaccine and done just fine, but they don't see the patients that we see in the hospital who get very sick. And so I think that's still one of the barriers that we're facing in clinic, is just getting those last few people who are not yet vaccinated to understand why we would really like them to get vaccinated. I think the other thing is, isolation is hard. I think we've learned a lot through the pandemic that isolation has undue effects on our mental health. It's, when you're sick and feeling lonely, that's the last thing you need is, that other pressure, the lack, not being able to go back to work and keep earning that income. I think all of those aspects of COVID are also really challenging.
Okay, well, let's talk solutions a bit here and the vaccine. It's a new day and we have a new guest. So talk a little bit about what is available out there right now. Let's talk first to the people who haven't been vaccinated. So what would you say to somebody sitting in the room who said, okay, I'm at least open to hearing about it? What would be important for them to know?
I think it's important to know that we have now vaccinated millions of people, and we have, whereas early on, quite honestly, when I went to get my vaccine in December of 2020, I was nervous. I was more scared of the disease than the vaccine, but I knew that vaccine had only been studied in thousands of people and that there could be side effects. And I think now we have so much data to reassure us that the vaccines are safe, well tolerated, and protect against severe disease. And so I think those people who were waiting for more data or longer term data can be reassured that we have that now.
Yeah.
I also, the two widely available vaccines right now are the Pfizer and the Moderna, which are both mRNA technology, which is a new technology which some people were worried about. But we just had the Novavax vaccine approved, and that's a more traditional technology that's been used in many other vaccines before. So those who were worried about the mRNA technology might be reassured to hear that Novavax is now approved and an option.
Okay, so I want to ask, especially for those people who love to do their homework and they're out there, so they're saying, okay, I may be open to this now. Is there a resource that you can think of off the top of your head that if there were an article somebody could read, or some testimonials, maybe by some other folks who waited for a while and then they went ahead and were vaccinated, and now they're like, yeah, that was no big deal. Where would you direct people to go for more information?
Yeah, that's a good question. I think their healthcare provider is probably the first step. You know, there is so much information out there on social media and on the internet, and it's hard to know what's based on fact and what's, you know, may have information that is not well researched. And so I think going to their healthcare providers in their local community is probably the first step. The CDC has very good information as well, but some of that has lagged in terms of being updated on a regular basis and other things. I think many people have been frustrated that the information keeps changing. You know, and what I tell my patients is that that's the nature of this pandemic. There was so much that we didn't know at the beginning, and so our guidance has changed, and that's just been a part of the evolution of the pandemic. And so making sure that whatever information they're going to has been recently updated, because you know, the millions of articles that get published every month on COVID are, you know, it takes experts to be able to sift through that and see what's true and what's, you know, maybe needs correction.
Okay, perfect. Now I'd like you to speak with those people who've been vaccinated but not boosted.
Sure.
So what would you say to them?
Yeah, so I would say that what we've learned is that, unfortunately, although the vaccines are very effective in preventing severe disease, they're not perfect in terms of preventing transmission, and that protection against severe disease wanes over time. And so it is very important to get boosted. If your last vaccine was over 6 months ago and you've only had a primary series, you know, 2 of the mRNA vaccines, it is important to get a booster, especially going into the fall. If you get an mRNA booster right now, that won't exclude you from being eligible for an Omicron-specific booster if that becomes available this fall. And so this is a good time to get boosted.
Okay, perfect. Now, what about those people who've been vaccinated and boosted once? Sure. Now they're thinking, oh, is it back to school time? Do I wait till, you know, winter when people are thinking about flu season? Yeah. What would you say to those folks?
So if you're vaccinated and boosted once, but under the age of 50 and not immunocompromised, you're not yet eligible for another booster.
Okay.
But if you're over the age of 50 or immunocompromised, then you are eligible for another booster, and same message. This is a good time to get that. If you've had, you know, the other question I get is, what if you've had a vaccine and you've had COVID? How long can the natural immunity provide a booster? There is some benefit to having had both a vaccine and natural immunity. There is some hybrid immunity that you're going to get from the combination. But what we're finding is that we are seeing a lot of reinfections with Omicron, and that protection, even with natural immunity, is only a couple months. So I would say after a few months, if you haven't had that booster, go ahead and get that booster.
Okay, thank you. And finally, children and
Sure.
vaccines. And that's really what's on the top of people's minds right now because the kids are going back to school. So what's the latest and greatest on children's vaccines?
I mean, the best news is that we now have 2 vaccines that are approved for children over the age of 6 months, which we were waiting eagerly for. Many of the infections that we've seen actually for example, in our employees have been household transmissions. So children are congregating, they're gathering, they need to be in person, they need socialization, and so vaccinations are the best tools we have to prevent children from getting sick and then transmitting to their more susceptible parents or grandparents who may be at higher risk for severe disease. And so we have both the Pfizer and the Moderna vaccine now available for children, and this is a great time to get your children vaccinated before we go back to school.
And when you say available, they just go to their pediatrician, they just pick up the phone and call maybe even Nebraska Medicine and say, hey, we're looking to do this, tell us where we go.
Yep, even pharmacies are able to vaccinate children, so many different locations for vaccines for children.
Fantastic. Okay. One of the things that we asked you to do, Dr. Bears, you were such a trooper, was to put together what you would say is the COVID-19 safety checklist. Now, this is mindful that our kids are going back to school. So these are the things that were at the top of your mind in terms of wanting to get parents really to be thinking about over the next few weeks. So let's go to that graphic and then you walk us through what you're suggesting for folks.
Yeah, so the first question I'm going to ask, as you know, I'm thinking about getting my kids back into school next week actually, are my vaccines up to date? Am I fully vaccinated? Have I had my booster? I know that as the children are going back, they are likely to get exposed to COVID, and I want to make sure that I'm protected so that I can continue to care for my patients and my children. The next question is, are my family members? So, everyone who lives in the household, are we fully vaccinated and boosted at this time? Do I or my children have symptoms that could be due to COVID-19? I think that's something that we need to be asking every day before we take our children to school, to avoid infecting other children in the school, teachers, staff members, and knowing that as children congregate, many viruses will circulate, not just COVID-19, and so we want to prevent both COVID-19 and the other viruses. The next thing I would think about was, if we do have symptoms, well, how am I going to test? And do I have a good supply of rapid tests available at home so that I can be prepared when my kid wakes up late for school and I don't have time to go take him for an official test? Can I test him before school and send him to school knowing, in full confidence that he does not have COVID and is unlikely to transmit to his peers?
Okay, thank you. I know that there have to be folks at home who are watching and thinking, ask her the question about, right? So we've had people who have been what we deem fully vaccinated, maybe even second boosted, and they're still being diagnosed with COVID. And people like that, and they're going, what more could we or should we have done? Just briefly talk about those folks and what kind of an impact should they be that worried? Talk to them for a second.
I have known many of those, and in the last few weeks, it feels like, there are more than ever fans and family members, patients reaching out to me saying, I've done everything I could and I still got COVID. And it's frustrating, and I feel for you. And I've been there. And so I think the first thing to do is remember, don't blame yourself, blame this virus. The reason it became a pandemic is because it's so contagious. And so, just rest assured that this is nothing that they've done wrong. This is the virus. It's sneaky and it's found a way to evade our immunity. The second thing is to rest assured that if you're fully vaccinated and boosted and then develop COVID-19, your likelihood of developing severe disease, needing hospitalization is exquisitely low. And so really be comforted by the fact that your immune system has encountered this, that little protein in the virus and is going to know how to react to it and not develop severe disease that's going to land you in the hospital.
Okay, perfect. I want to take the last 5 minutes of this program and I want to change gears for a minute and talk about something else that people are seeing even more so on the news now, and that is monkeypox. Okay, so as you and I are sitting here today, how do you explain monkeypox to somebody?
Yeah, so monkeypox is a virus that's in the family orthopox virus. Actually, smallpox is also in that family of viruses. It's a virus that is not new. It's actually been around for many, many, many years, but it was endemic in parts of Africa. And most typically, the outbreaks that we saw were due to travel to areas where it was endemic. What we're seeing now is that it's another variant of monkeypox has spread worldwide.
And it spreads how?
So it spreads a couple of different ways. So it can spread from animals to humans, but in this outbreak, it's spreading from person to person. And we're seeing it spread, in this case, through a couple of different means, largely actually sexual contact. And so although it's not a sexually transmitted infection where it's exclusively transmitted through sex, because it spreads through direct close contact, it is spreading in this outbreak largely through sexual contact. And so it can spread through direct contact with the rash, with the lesion. It can spread through contact with an object that an infected person has been, in close contact with. So clothing and sheets, bedding are the most common ways in which it's spread. But again, in this outbreak, we're seeing predominantly sexual contact.
So it's pretty startling to look at. So we don't want to, obviously strike fear in people, but there will be folks who say, okay, so how would I know early on, right? Like the signs and symptoms for COVID, we kind of have a better idea now. Are they, what if they see a rash appear? Talk a little bit about what those early signs and symptoms are.
Yeah, sure. So this has been an interesting outbreak to see because it's behaving a little bit differently than the virus that we knew of before. And so we're seeing largely the first sign is a rash. And what's unique about the rash is it can look like a blister or a pimple. But oftentimes these are presenting solely in the genital area or in the rectal area. So they can look just like another sexually transmitted infection. And so it's important to be on the lookout for any blister or pimple-like lesion or sore that appears in the genital area. We can also see them on the skin, and they can be on any part of the skin. So they can be on the face, on the arms, the legs, the hands, the palms, the soles, the feet, any part of the body.
Dr. Bears, if somebody is suspecting this, who are they to call, like their primary physician, or what is that important first call for them to make?
Yeah, so primary physicians are being educated around the country, and so that is absolutely the first point of contact. And you want to call and not just show up in the clinic if you're concerned about monkeypox, because it can be contagious, and so we have protocols for how to bring patients in safely to the clinic so that we can evaluate and test for monkeypox if testing is indicated.
Okay, no cure, but a vaccine, because you talked about smallpox.
Yeah.
Talk a little bit about that.
Yeah, so fortunately, there is a vaccine that has been actually used for monkeypox specifically. And so there is a vaccine for monkeypox. It's not available in large quantities, but it is available, and distribution or production is increasing as we speak because there is a need. And so there's a vaccine. It's effective in preventing monkeypox, but it's also effective after an exposure. So if we administer it to someone who has had a known exposure to monkeypox, it will actually reduce the chance of them actually going on to develop symptoms, or even severe disease if they do develop symptoms. So it's a vaccine that is available, and so people who are at high risk or have had a known exposure should inquire about the vaccine.
Okay, talking with Dr. Sarah Bears today about monkeypox just now, but also the COVID-19 safety checklist. We have some websites for our viewers if they want to learn more information. COVIDCDC.gov, of course, FDA.gov, DHHS.ne.gov. And then NebraskaMed.com. Dr. Bears, thank you so much for being here today and sharing your time and expertise. Best wishes to you and your team moving forward. You guys have a lot of work to do. Thank you so much for everything you have done.
No, thank you so much. It was a pleasure to be here.
You bet. And thank you all for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at nebraskapublicmedia.org/considerthis. If you'd like to share your comments about this program, call UNO Television at 402-554-2516 during regular business hours, or send an email to cwyatt@unomaha.edu.